Welcome everyone to our second session of the Aging Gracefully course. I am so glad to see you all back and dive into this topic today of baseline measurements. By now we've introduced the key concepts of the Aging Gracefully, but now we're going to make it personal. We're going to gather important objective data which can help customize the approach of the aging process, and we can make your own individual exercise routine. Why are these baselines important? As we age, no two people are exact and they're going to be having different needs. We have to maintain cardiovascular fitness. We have to maintain strength. So it is important that we gather information with cardiovascular strength, mobility, metabolic health, and bone density and muscle mass. And we can end up doing all this throughout this process. The more information is better to figure out what our needs are. Much of what we cover today is influenced by the Peter Thiel's work. If you're not familiar with his podcast, The Drive, or his book, Outlive, I strongly encourage you to look into this because that's where a lot of this information is from. And if you want to dive deeper into any of this, feel free to do so. For those who do not know me, my name is Matt. I'm the physical therapist at GL Rehabilitation since the end of 2020. This helps me provide for my wife and 3 kids. And throughout this process, I started off my journey being born and raised on a dairy farm in western Wisconsin called Prescott. I stayed living on the farm to attend the University of Wisconsin River Falls, and I obtained a certification of exercise sports science and with the certification of exercise physiology specialist. Then I went to University of Wisconsin-Madison for my doctorate of physical therapy, and while I was there I obtained my certification in strength and conditioning specialist. After that I obtained and did my residency in orthopedics at UW Health in Merida, and I got the chance to sit for the orthopedics clinical specialist. So I know it looks like I have a lot of alphabet soup at the end of my name. I just wanted to demonstrate and show how passionate I am for helping others. And this is the whole point of why I want to further my education and keep on learning to help my patients get the best care that they deserve. Alright, this is our second week assessing baseline fitness. And so, as we talked about, these are the different outlines of what we're going to be accomplishing today, as well as what we're going to be accomplishing in the next couple of weeks. Just as a note, next time, if you don't feel comfortable getting these baseline measurements by yourself, we will be obtaining these baseline measurements next time. So bring workout gear. We're going to be using the gym as well as doing some exercise. So bring your exercise gear. Just some housekeeping things. Each class, again, as a reminder, is going to be $10 per session. This gives you online access to all of the courses. And if you do not feel comfortable doing the activities, doing day-to-day tasks and functional activities, do you have any injuries or pain, this does qualify you for physical therapy, or probably will qualify you, and we can probably get you in order of physical therapy if you feel like this is impeding your way of exercising and living the best you can be. And just as a disclaimer, GL Rehabilitation and myself, this is only for educational purposes. This is not individual advice, more general guidelines that you can use. Feel free to get cleared from your doctor, because we are not liable for any decisions based on this course. Falls are a major concern for adults as they age. With 1 in 4 adults over 65 experiencing a fall each year, these falls can have serious consequences, from injuries to loss of independence. However, the good news is that many falls are preventable. Awareness is the first step, and that is where our personal falls risk assessment comes in. This assessment is based on a validated tool used by healthcare providers nationwide. It includes 12 questions designed to identify specific fall risk factors. Before we begin, I want to remind you that this is entirely for your personal awareness. You won't need to share your answers with anyone. As we go through each question, keep track of your yes responses and their associated points. As you answer, think carefully. These questions aren't random. These are grounded in research and highlight areas that can contribute to falls. For instance, if you have fallen before, research shows that you're higher risk for falling again. If you use furniture for support, it may signal you need improved balance training. And if you feel unsteady or feel difficulty raising from a chair, it's often related to leg strength, which can improve with target exercises. We're going to go through each response and the associated points. So mark down the yes and the associated points. Have you fallen in the past year? Yes is 2 points. I use or have been advised to use a cane walker to get around safely. 2 points. Sometimes I feel unsteady when I am walking. 1 point. I steady myself by holding onto furniture when walking around the home. 1 point. I am worried about falling. 1 point. I need to push with my hands to stand up from a chair. 1 point. I have some trouble stepping up onto a curb. 1 point. I often have to rush to the toilet. 1 point. I have lost some feeling on my feet. 1 point. I take medication that sometimes make me feel lightheaded or more tired than usual. 1 point. I take medication to help me sleep or improve my mood. 1 point. I often feel sad or depressed. 1 point. Now we completed the assessment. You'll tally up your points. If you score 4 or more, it suggests that you may have several fall risk factors to address. Do not worry, this is the first step in preventing falls and maintaining independence. Next, we'll discuss practical steps you can take, such as starting a strength and balance program, reviewing your medication, making small but impactful home modifications. Remember, this isn't about limiting your activities, it's about identifying your risks early and taking action to protect your independence and quality of life. Before embarking on any physical activity or exercise program, it is critical to make sure it is safe to do so. That's where the PAQ-Q Plus, or Physical Activity Readiness Questionnaire for Everyone, comes into play. This tool helps identify potential health risks or concerns that might require medical clearance or activity modifications to ensure your safety. Whether you're starting a new exercise routine, joining a fitness class, or increasing your activity levels, the PAQ-Q Plus serves as the personal guide to ensure you are physically prepared. As we walk through the key elements of the PAQ-Q together, first let's explore the 7 core questions that is critical for the screening tool. What happens after answering them and how it ensures activity readiness for a wide range of individuals. The PAQ-Q Plus is internationally recognized screening questionnaire that is easy to use, highly accessible, and evidence-based. It's designed to ensure that exercise is safe for you by identifying any potential risk factors or identifying underlying health conditions. What's great about the tool, it it that it doesn't just stop at identifying risk. It provides actionable steps for those who need additional support, for, for such as medical clearance or exercise modification. The core 7 questions. Now let's consider a closer look at the 7 core questions. Answering each question is a simple yes or no and helps you pinpoint specific health concerns. Here's what they assess. Number 1, heart conditions. The first question asks if a doctor has ever diagnosed you with a heart condition or advised you to avoid physical activity. This helps you flag individuals who might need clearance from a cardiologist before starting exercise. 2, chest pain during activity. This question identifies any history of chest pain or discomfort while exercising, symptoms that could indicate angina or chest pain or other cardiac issues. Dizziness or loss of balance. If you're experiencing dizziness, lightheadedness, fainting, especially during exercise, it is critical for assessment that assessing the cause before exercising further. Joint or bone problems. Have you had any injuries or chronic joint issues like arthritis that could worsen with certain movements? This question helps identify those who might benefit from low impact exercises or specific modifications, and having a guidance from physical therapy to help start that program. Medical for chronic conditions. Medications can sometimes affect your blood pressure, heart rate, balance. These questions ensure that potential side effects are taken into account. Chronic diseases and conditions. This broad category includes conditions like diabetes, COPD, other chronic illnesses that require adjustments to your activity. Other reasons to avoid activities. Finally, the catch-all question gives you the opportunity to highlight any other concerns, whether it is recovering from a surgery or dealing with undiagnosed symptoms. Now, what happens after you answer the 7 questions? The next step depends on your response. If answering no to all of the questions, congratulations, you're clear to start physical activity. The PAQ-Q Plus advises you to start slowly, especially if you've been inactive, and gradually increase the time and intensity slowly. If you've answered yes to any of the questions, don't worry. It does not mean you cannot exercise. It simply means that further steps are needed to ensure your safety. The follow-up questions. The PAQ-Q Plus includes additional questions to gather more information and details about your health. For example, if you had chest pain, it asks you about the frequency, the severity, and whether the condition is managed under a doctor's care. Medical clearance. If the follow-up questions reveal any potential risk, you would be advised to consult your healthcare provider. This could involve filling out a clearance form, which is included in the PAQ-Q Plus package, and bringing it to your doctor for approval. Self-management. In some cases, the follow-up questions have determined that it is safe for certain precautions. For example, if you have joint pain, the recommendations might be to stick to low-impact activities or avoid specific movements. Next, the PAQ-Q Plus also includes sections for individuals with specific needs, such as pregnancies, older adult, activity modifications. All of these need to be addressed, as well as so let's go through pregnancy. If you're pregnant, there's specific specialized tools that can help guide you to make sure you're safe each of your pregnancy and the trimesters of each one. Older adults, those over 65, emphasize the importance of a gradual progression, focusing on low to moderate intense exercises to build strength and endurance first before diving into higher stuff. Activity modifications. The question offers advice how to adjust exercise routines to suit your individual needs. This could include changes to the type of exercise, intensity, and duration. The key principles behind the PAQ-Q are personalized, safety first, encourage activity. So personalized, it helps you individualize your path to your fitness, and if it's safe. That is the primary goal, is making sure we reduce the risk and making sure it is safe to exercise. By identifying the risk, it's ultimately designed to help you encourage you to be physically active with confidence. Finally, depending on your answers, you might fall into 3 categories. Clear to exercise, you can begin exercises with confidence, but remember to start slowly and progress with care. Referral for medical clearance, if they are identified, you'll be recommended to the guidance and to seek medical assistance for personalized recommendations. And lastly, tailored recommendations. For manageable conditions, you'll receive advice on how to modify your activity safely. So this is a lot of stuff. So how you can access this? If you Google search or go to the internet browser and go search the PAQ-Q Plus, and it is available online and is incredibly user friendly. You can fill it out electronically or online, and tells you step by step, gives you it, and you can even print it out and you can give it to your doctor. So by closing, the PAQ-Q Plus is more than just a screening tool. It's a gateway to safe and effective physical activity by identifying risk and provide clear next steps. It empowers individuals of all ages to take control over their health and fitness journey. Whether you're new to exercise or looking to modify your routine, the PAQ-Q Plus ensures that you can do so with confidence and peace of mind. So, why do baseline measurements matter? Simply put, they essentially are charting your starting point. Without them, it's difficult to measure progress or identify what's working and what needs improvement. Let's start by cognition. Research highlights the importance of cognition in falls prevention. Research found higher levels of executive functioning helps us better multitask for balance, reducing the risk for falls. We'll use tools like the trail making test or the Montreal Cognition Assessment (MoCA) to assess cognition. Each test gives us valuable information on how well your brain processes information and managing tasks. Moving on to cardiovascular, this area reflects how well your heart and lungs are performing together. Metrics like your resting heart rate, your VO2 max estimation gives a snapshot on your overall cardiovascular fitness. Next, we have strength, which is assessing your key muscle groups. Maintaining strength as you age is vital for independence and falls prevention. For instance, leg strength is closely tied to the ability to stay balanced and prevent falls. Lastly, stability and mobility play a huge role in functional movement. We'll evaluate how well your body maintains balance and flexibility, skills that work in conjunction with cognition function to keep you upright and agile. Remember, today is all about gathering information to help us build that personalized goal and personalized plan for you. These assessments are the first step in empowering you to take control of your health. Let's get started and dive into each category so we can better understand where we are about to set forth and put you on the path for aging gracefully. We're talking about a critical role of cognition plays in aging gracefully. high cognition function does not just contribute to mental sharpness, it actively helps us prevent falls. Research such as the study by Morale et al. Has shown the older adults with higher cognition functions are less prone to falls due to their enhanced processing speed and decision-making abilities. This highlights the need for regular cognition checkups to maintain both mental and physical health. We'll explore two tests today: the trail-making test, the TMT, or the Montreal Cognition Assessment, or the MoCA. The TNT is a quick and focuses on processing speed and executive function, only taking 2 to 5 minutes. It is a great for routine monitoring and can reveal difficulties in multitasking and processing speed. The MoCA, on the other hand, is more comprehensive. It takes about 10 minutes. It assesses memory, attention, uh, language, visual, spatial skills. It is perfect for a broad overview. It scores anything below 26 signals the need for closer cognition testing. Since it is a little bit more time consuming and I can't do it in a group setting, that's something that we might reserve the right to do that on a one-on-one routine session. We're going to be doing the trail making test today. Now, why are these tests so important? Regular cognitive assessments allow us to detect early changes and enabling timely interventions. High cognition function has been shown to be protective against falls, enhancing reaction times and balance. So incorporating these tests into your health regime can help a significant difference in maintaining your quality of life as you age. So this is the trail making test part 1, or part A. So we're going to see how long it takes you to go from 1 all the way up to the highest number on that. So you go from 1 to 2 to 3 to 4 to 5 to 6 to 7 to 8, and then seeing how long it takes. In the lecture, I'm going to have a timer on the screen, so I'll let you keep track of your time. And the next one so there is a printout that I'm going to give you, and you're going to do that because this is the easy component. It goes up to much higher numbers on the printout, and you'll be end up doing that. So you'll be literally tracing your pencil from that area and recording your time on your baseline measurement sheet, seeing how long it takes. And also there's errors. So if you do figure out that you are going to the wrong spot, if you self-correct it, does not classify as an error. If you don't identify it as an error when you're in the test, that's something that you have to mark as well. So write the time down, and then after that, review your line. And if you find that you didn't know that you made a mistake during the test, that's a sign that is an error. So you're marking how many errors you have as well. So same part. This is going to be part B. So it's similar. We go to A, then we start at 1, then go to A, 2, B, 3, D, 4, D. So, and seeing how long it takes you from doing this component. Same concept before, marking how long it takes, and how many errors you have with this as well. You have a sheet of paper that you will be physically marking this on and we'll be testing that and marking that on your baseline measurement sheet. Today we're discussing the FROG Senior Fitness Test. It is a comprehensive assessment tool that helps us understand and track physical fitness in older adults. This isn't your typical fitness test. It is specifically designed to evaluate your kinds of strength and mobility you need for everyday life. Think about your daily routine: getting up from a chair, reaching items in your kitchen cabinet, or hurrying to enter the door. Each component of this test relates directly to real-world activities. What makes this test special is both scientifically valid and practical, using Simple activities like standing from a chair or walking for 6 minutes to give us valuable information about your fitness level. We conduct these tests at regular intervals, first to establish your starting point, then again after a few months to see your progress, and annually after that. This helps us catch up with potential issues early and adjust your fitness program as needed. The best part, every result is compared to others in your age group, so you're getting a realistic picture of where you stand. The test is designed to be both safe and, I dare to say, enjoyable. We use familiar movements that we do every day, just in a more structured way. This isn't about competing with others, it's about understanding your own fitness level and tracking your own progress over time. By understanding key areas of fitness, we can together maintain your independence and quality of life, ensuring you can continue doing the activities you love with confidence. Some questions you might get: is it safe? Yes. Use everyday movements with modifications if available. What if I can't do something? Alternative tests are available, so just let me know. How long does it take? It can take about 30 to 45 minutes depending on how familiar you are with the test. Do you need any special equipment? You do not. Just a chair and a stopwatch. And a measuring device like a tape measure. Let's dive into the 30-second sit-to-stand test, a powerful tool that tells us much about your functional fitness and independence. It isn't just any exercise test, it is a window into how well you can perform everyday activities that matter. This test is special because every time you stand up and sit down, you're performing a complex movement that requires strength, balance, and coordination, and this test captures all of it. Now, there's two ways of performing it. The 30-second sit to stand is a quick snapshot into your capabilities, but you can double it to capture more of your endurance. So one of the goals, like if for 30 seconds you stand for 15 times, then you should aim for 30 stands in a minute. Pacing is critical, but I do encourage you, if you feel comfortable, try to go as fast as you can with keeping good form, and you will be huffing and puffing. Your thighs will be burning. Let's look at our norm tables. Notice some different targets in different age groups. So we want to try to aim, if you're new to exercise or new to activities, try to aim for the higher range of the below average group, and then slowly go to the average and then above that average. And then once you've mastered the above average, don't stop there. Then aim for an age category below yours, or two categories below yours. And then try to maintain that as long as possible, because no one wants to age normally. We want to age gracefully and be superior with aging, because that's going to allow us to do a whole lot more things. So here's something I am particularly excited about, is the progressive nature. If you're just starting out, you can always slowly progress from there and work up higher. So it gives you a great goal to work through. And let's talk about the proper technique. A complete repetition means you're coming to full stand with hips and knees extended, so all the way straight, then returning to fully seated position. No half stands or half sits count. And yes, it's okay to use your arm. It's okay to use your arms if you need to. Just mark that down on your sheet. But ideally, all these norms and numbers are based on when you're crossing your hands over your chest. But it's okay to start off with using your hands, pushing off of the chair, then eventually go to your thighs, and eventually just reaching forward with your hands, and then doing the cross test. One of the most important aspects of this test is the tracking. As I recommend testing yourself monthly, keep a log, celebrate improvements, and adjust your goals accordingly. Remember, this isn't just about numbers, but maintaining and improving your functional independence. Before we wrap up, I want to emphasize something important. This test is adaptable for your current fitness level. Start where you are, progress at your own pace, and always prioritize proper form over speed. The goal is long-term improvement, not short-term records. Diving into how you can assess the upper body strength as we age. This seated arm curl test. This isn't just about building muscles, it's about maintaining our independence and ability to perform activities that we often take for granted. This test is beautifully simple. Using a 4-pound dumbbell for women and 8 pounds for men, participants perform as many arm curls as possible in 30 seconds while seated. This makes the test so valuable. What makes this test so valuable is it mimics movements that we do every day, like lifting groceries, picking up a grandchild. Let me walk through what is considered norms. For example, if you're a woman between 60 and 60, completing 13 to 19 reps in 30 seconds puts you in the average category. For men of the same age, that is 16 to 22 curls, these numbers naturally decrease as we age. That is completely normal. This key is maintaining our strength appropriately. What's fascinating about this test? How it reflects our ability to perform everyday activities. Think about reaching for items in the kitchen, carrying laundry baskets, lifting a pet. These are requirements, the same type of strength that we're measuring here. The beauty of understanding these norms is it gives us a goal to work towards. If you find yourself below the average for your age group, don't worry. This is precisely the kind of information that can motivate us to incorporate strength training into our day-to-day routine. Remember, aging gracefully isn't about competing with younger versions of ourselves. It's about maintaining functional strength that allows us to live independently and enjoy our activities of daily living with confidence. The next aspect of aging gracefully is maintaining our lower body flexibility. I'm excited to share with you the chair seat to reach test, which is more than just touching your toes. It's about maintaining your independence and quality of life. Think about your morning routine. When you put on your socks, tie your shoes, or pick up something from the floor. All these movements require the flexibility we're measuring with this test. It is simple, everyday actions that make this assessment so valuable. The beauty of this test is it's simple and safe. You sit at the edge of the chair, you have your legs straight, you reach forward towards your toes while keeping your back straight. That's very key, back straight. There's no need for complex equipment or difficult positions. Now that's fascinating. Now what's fascinating about the test is how it accounts for your age. For instance, if you're a woman between 60 and 64, reach anywhere between half an inch short of your toes to 5 inches past your toes is considered normal range. For men the same age, it's slightly different. From 2.5 inches short to 4 inches past your toes is normal. The ranges naturally adjust as we age, and it's completely normal. What's really important to understand is that this isn't about comparing yourself to others or even younger selves. It's about maintaining functional flexibility that allows you to move comfortably through your day-to-day activities. The good thing is that flexibility can be improved at any age with regular gentle stretching. A quick note of safety. This test should be avoided if you have osteoporosis, because it does put some stress along that skeletal system. So you can do this, but you have to make sure you're very gentle with your movement. No bouncing or forceful stretching. Gentle control movements are always the best. A few tips about flexibility. You should always be doing this test when you are warm and you're kind of having a light sweat going. So I encourage you to do a walk before it or some kind of way to kind of get your body moving a little bit. as we don't want to pull any muscles here. And the same aspects of when you are trying to improve your flexibility, trying to get your muscles warm. And we can talk about a few different techniques, such as the contract relax technique, where you're contracting those hamstring muscles for 5 seconds gently, then reaching farther, and repeating that a few times as a way to kind of trick the nervous system to get a little bit more effective on the stretch. And making sure you breathe. Breathing in through your nose for 2 seconds, out for 4 seconds. Hold your breath for 2 seconds without having any breath. So in for 2, out for 4, hold for 2 is a good starting spot for your breath when you're trying to relax into this. Now, another practical test is we always take for granted is the ability to reach behind our back and reach behind our back and over our back. This movement might seem simple, but it's absolutely critical for our independence and activities of daily life. Think about your morning routine. You get dressed, brush your hair, you reach for a seat belt in your car. These activities requires flexibilities. We're measuring this with the back scratch test. This isn't just about flexibility, but maintaining our independence and quality of life. Let me demonstrate how this works. You are trying to reach one hand over your shoulder and down behind your back, while the other hand is reaching up from below. You're trying to bring your middle fingers as close as possible together. Well, what's really interesting is that we're having natural preference for which arm goes on top, which matches our dominant hand. Now here's what is available. It's incredibly practical. This results directly correlate with your ability to perform everyday tasks. If you find this movement challenging, you might also have difficulty things like fastening your clothes, reaching for objects on high shelves. Let's talk about what's normal, because this varies significantly with your age and gender. For instance, if you're a woman between 60 and 64 years old, having your fingertips touch anywhere from 3 inches apart to 3 inches to 1.5 inches overlap is considered normal. For men in the same age, it's different. It's important to know that it's completely normal as we are getting older, and the table adjusts for that. What I find most encouraging about shoulder flexibility is that it can improve at any age. Regular stretching exercises can make a significant difference. However, this is critical. We never want to force these movements. If you feel pain during the test, that's how your body is signaling to stop. And just like the lower body flexibility, making sure our arms are nice and warm, and we can do some arm circles, arm kind of movements back and forth to make sure your body is warm. If you feel like you want to go for a light walk, getting a light sweat going is going to be important. And you're going to have the best results on the test. And some few safety notes. Always perform stretching, a warm-up exercise before stretching, and avoid bouncing movements. Remember having a slight stretch. 0 is no stretch. 10 is going to be your muscles are snapping. We want like that 5 or 6 stretch. And it is okay if you have any pain in the shoulders doing this. It does actually qualify you for physical therapy. So I do recommend, if you feel like you are needing some of these physical therapy, we have a team of physiotherapists on staff, and they're here to help you out. And what I love about this test is not just about measuring, it's about understanding your body and knowing where you might need to focus your efforts. The goal isn't about achieving perfect flexibility. It's about maintaining your range of motion you need to do your activities of daily life. The next practical test we're going to do for seniors is the 8-foot up and go test. You might have heard the 10 foot, so there's two different variations. This one's more the 8 foot, so the numbers might be a little bit different than if you saw this test somewhere else. What makes this test so valuable is that it mirrors mimics that we do every day, like getting up to answer the door, rushing to catch the phone. Think about your day-to-day life. How many times you need to quickly get up, walk somewhere, maneuver something, and sit back down. Happens more often than we realize. Whether you're using the restroom, getting up and off the bus, moving through a crowded restaurant, this test measures exactly how we can handle those everyday challenges. It all starts when you're sitting from a chair. When you say, "Here you go," you're going to stand up, walk as quickly and as safely as you can to the mark on the ground or the cone, turn around, come back, sit down, and then the time stops. It sounds simple, but the test has multiple skills. At once, your ability to get up from the chair, walk quickly and safely, maintaining balance while turning and controlling your movement when sitting back down. What's fascinating about this test is how it combines so many different elements of fitness. We're looking at your leg strength when you're standing up, your balance when you're turning around, your coordination when you're maneuvering, that that's sitting down, and overall agility through the movement. It's like a mini obstacle course that reflects real life challenges. Let us talk about the considerations of normal timing. For example, women between 60 and 64 years old completing this test anywhere between 4.4 to 6 seconds. It is considered normal for men the same age to go slightly faster, 3.8 to 5.6 seconds. And yes, these times naturally increase as we age, which is completely expected, and that's what it represents in the table. What I find encouraging along the test, it measures the skills that we can improve and practice. Simple exercises like to sit to stands, walking, and balance training can enhance your performance, and better performance means better confidence in your day-to-day tasks. Safety is paramount, which is why we have specific and important guidelines. First, we always have the chair placed against the wall for safety and stability. You should walk as quickly but as safely as you feel comfortable. It isn't a race, and we're not running. If you normally use a cane or walker, it's absolutely normal to use that during the test. You just record it on your sheet. And also, you can use your hands to push up if you need to. Just record that on the sheet. If you have any dizziness or having troubles with that turning quickly, just note that might slow you down. I'd rather have you be safe instead of falling. Have a loved one there around that turning around if you don't feel comfortable at first, and eventually you're going to feel comfortable. One aspect I particularly want to emphasize in the test is more about speed, is about the controlled movement. Moving too quickly without control actually increases your risk for falls. The goal is to find that sweet spot between efficiency and safety. A practical tip many people find: think about a controlled hustle rather than a race. Imagine you're moving to answer the phone. You want to get there before it stops ringing, but you definitely don't want to fall on the way there. Now let's discuss the dual timed up and go or the tug test. This is the advanced variations of the standard timed up and go test, which helps us understand how well a person can maintain mobility while performing a secondary task. This is especially important because daily life often requires us to do multiple things at once, such as walking while talking, carrying groceries, managing distractions. By evaluating dual task performance, we can identify potential risks and tailor interventions to improve functional mobility and reduce falls. Before we perform the dual task, we need to first perform the measurements of the standardized tug. The slide before had us do an 8-foot tug. Now we're going to do a 10-foot tug, so we're just going to have extra practice. So this allows us to compare performances without a secondary task. The setup is simple. Use a standard chair 18 inches with armrests, have a 3 meter or 10-foot walkway, a visual marker at the turning point, and a stopping watch. The first variation is a dual tug task. As the variations, we ask the patient to count backwards from 100 by threes while completing the standardized tug. The purpose of the test is to measure how well a person can maintain balance and mobility while engaging in mental tasks. This is particularly useful for patients with cognitive impairments or those at risk for falls due to divided attentions. The second variation is a manual or motor dual task tug. Here, the patient carries an object such as a glass of water while completing the test. This simulates real-world situations where individuals must carry items while walking. The object can be customized based on the patient's lifestyle or goals, making the test more relevant to the daily activities. To quantify the impact of the dual tug, we calculate the dual tug cost. The formula is straightforward. We take the difference between the dual tug and the single task, divided by the single task time, and multiply by 100. For instance, if a patient completes the tug in 10 seconds, the dual tug in 15 seconds, the dual cost would be 50%. This percentage helps us determine how significant an additional task affects our performance. Finally, we compare our patients' results to established norms. Research indicates the healthy older adult completes the standard tug in about 8.39 seconds, with the cognitive and manual variations taking slightly longer. These benchmarks allow us to assess whether the patient's performance falls within expected range or suggested a higher risk for falls. In summary, the dual tug is an essential tool for evaluating mobility under real-world conditions. By incorporating cognitive and mental challenges, we gain a clearer picture of a patient's functional capacity and can design targeted interventions to enhance stability, safety, and independence. The last test is going to be the 2-minute step test, a remarkably simple yet effective tool for assessing cardiovascular fitness and lower body strength. This test is particularly valuable because it can be performed anywhere, requiring no special equipment, and is suitable for people of all ages and fitness levels. Let me walk through why this test is so important. As we age, our ability to perform activities often depends on cardiovascular endurance and lower body strength. This test gives us valuable information about both these aspects of fitness. The beauty of this test lies in its simplicity. You simply march in place for 2 minutes, lifting your knees to about the halfway part between your knee and your hip. It sounds straightforward. It provides a critical data about your functional fitness level. And here what makes it so unique. Unlike complex gym equipment or elaborate fitness assessments, this mimics what we do every day, like climbing the stairs, stepping over obstacles. This makes it particularly relevant for evaluating real-world fitness levels. This test is highly adaptable. If you're concerned about balance, you can perform this near a wall or a sturdy chair for support. This accessibility makes it an excellent choice for people of all ability levels. I want to emphasize the importance. It's not about the number, it's about understanding your current fitness level and setting realistic goals for improvement. The normative data I've provided gives you a framework to understand where you compare to your others in your age group. But remember, the most important comparison is with yourself and previous performances. Look at your normative data I've shared. You notice that the expected number of steps varies by age and gender. This is probably normal. As you're getting older, it's going to go down a little bit. That's why it's represented in the table. And knowing that our goal is trying to slowly work from the below average to the average to above average, and then going from that next age group from there. And these are just a way help to track your fitness, but also your little goals as well. But remember, try to warm up a little bit before the test. We'll make sure we're safe during the test. Remember to maintain good posture, breathe regularly, and stop if you have any discomfort. The test should challenge but never cause pain. You're gonna probably feel some like muscle burning, maybe some huffing and a puffing while you're doing this, and it's totally fine to have that, and that's kind of the goal of measuring cardiovascular fitness. And from there, we actually can measure and estimate some other VO2 max measurements. Cardiovascular fitness is one of the best indicators of our health as we age. It's not just about feeling fit, it's critical for how our body functions every day. Cardiovascular fitness measures how efficiently our heart and our lungs supply oxygen to our working muscles, which helps us move and perform daily tasks. When this system works well, it significantly lowers the risk of heart disease, stroke, and other chronic issues that often arise as we get older. Now, beyond just protecting against heart disease, maintaining cardiovascular health reduces our risk for other chronic diseases. Research consistently shows that people with good cardiovascular fitness have lower risk of high blood pressure, diabetes, and certain cancers. This means it is a constant cardiovascular exercise has a profound impact on long-term health. It also is linked to better mood, having a higher cognition, with increased blood flow from exercise supports brain functions and helps combat symptoms of anxiety, depression, and a decline in memory. Finally, there's a quality of life factor. When our heart and lungs are fit, it's even simple tasks like taking the stairs, gardening, and keeping up with our grandkids feel more manageable. Cardiovascular fitness means that more independence, and we can enjoy more fulfilling those day-to-day tasks. So let's look at some practical ways we can measure our cardiovascular fitness. The gold standard is getting the VO2 max, going into the lab and having a face mask measuring your how much oxygen you're consuming, how much carbon dioxide you're performing, but that's not accessible all the time. So ways you can estimate it is one measure is going to be the 2-minute step test. This is a straightforward way to assess cardiovascular fitness and lower body strength. You march in place, alternating each knee to about halfway between your knee and your thigh. This height ensures that we're engaging muscles enough to get a good endurance estimate. After 2 minutes, you can count how many times your right knee hits the mark, then compare it to the normative data to see how you measure up. The 6-minute walk test. This test is a low impact but supplies a simple measure. How far can you briskly walk in 6 minutes? The goal is consistency, not overexertion. This is especially useful when it mirrors real life activities we do, like providing a clear sense of our current cardiovascular health. The Rockford walking test. If you're interested in getting a little closer estimation of your VO2 max, the Rockport test might be for you. This one involves walking 1 mile briskly, then immediately measuring your heart rate after. This rate, combined with your time and age and weight, and you can be a good estimation of your VO2 max. So as we're going through the list, the 2-minute walk is going to be the least accurate because it's the least time consuming, and as we go forward, it's going to get closer and closer to your actual VO2 max estimation. And a quick note of safety: before trying any of these tests, be sure you have clearance from your healthcare provider. These tests are meant to challenge your cardiovascular system, so your safety is the topmost priority. And remember, listen to your body. If you're experiencing any discomfort like chest pain, dizziness, please stop immediately. And just making sure GL rehab is not liable for any injuries during these tests. This is educational information. We want to make sure your safety is key. Now, let's break down some estimations of your VO2 max from your scores. And here gets really interesting. The relationship between the steps and your VO2 max is kind of broken down, and you can actually help correlate this to some activities you normally do. So if you can achieve 65 to 75 steps in 2 minutes, you're at the level that supports basic activities like preparing light meals, self-care. Pushing that up to 76 to 90 steps, you're more comfortably grocery shopping, doing light housework. But bringing them up to 91 to 105, you're in the sweet spot enjoying activities like social dancing and water aerobics. Here's an exciting spot. If you can manage all the way up to 106 to 120 steps, you're obtaining more activities like swimming, hiking, even tennis. This is where the real impact of cardiovascular impact is. So those things, as you can mention, they're estimating your VO2 max at those specific levels. So let's take a tip that many people overlook. We're not just reaching for these numbers, it is maintaining them consistently. Regular testing helps us track progress, adjust fitness routines accordingly. I recommend monthly assessments to keep tabs on how things are going. Remember the test is an exercise, so might as well add this to a monthly routine to just add this into to keep track of these numbers. These numbers are not just things on the slide. These are things that indicators of how well your ability to live life fully and independently. Each step you take in this test represents the capacity of your daily life, from playing with grandchildren to traveling and pursuing hobbies. Again, safety is paramount. Always make sure you have good pacing throughout this process. And this is the fun part. You can always view this as, oh, I'm in this 65 category. Let's aim for the next one. So next month, try to slowly keep adding up. And it's a good way to shoot for your goals. Finally, I just want to emphasize these are standards, not guidelines, not rigid rules. Everyone's fitness journey is unique, and success looks different for each person. The key is consistency and improvement over time, no matter what your starting spot is. And as I mentioned, we have Y Exercise on here. I reached out to him and he's able to give you breakdowns of the 6-minute walk test and the Rockport. I have some in my presentation notes, but I do encourage visiting his website to dive more in depth about these topics of the other two tests. So we just spent a lot of time on testing of VO2 max, but why is it so important? In simple terms, VO2 max is the max rate of oxygen consumption your body can handle during exercise. It is a direct reflection on how well your heart, lungs, and muscles work all together. Keep you moving beyond its role of fitness. VO2 max is a powerful indicator of overall health. And a higher VO2 max means you have a lower risks for developing chronic diseases and lower risk of mortality over time. Let's look at the charts. Y Exercise has a wonderful website, and they kind of have great figures of having your different age categories, and has different categories of where you fall within that. And from there, it allows you to figure out if you are in the poor versus all the way in the highest and elite levels of it. This is where we talked about trying to aim for your being in that superior category and then trying to go for 1 or 2 decades below where your actual age is. So, as lastly, don't forget to check out Rob Carl. He's a PT, and he's the one that made this images, and I shared the video with him during our first session of Y Exercise. He is a PT doing the same message, trying to promote healthy living and aging gracefully through exercise. He has great resources, so please check him out. He is more than willing to help you guys out, and there's lots of videos along the way to help you understand. So let's talk about VO2 max and its importance of biomarker for longevity. VO2 max is one of the most reliable indicators of both how long you'll live, your lifespan, and how healthy and functional you will remain as you age, known as health span. Here's what makes it such a powerful biomarker. VO2 max integrates several systems in your body: your heart, your lungs, your muscle, your circulation, all work together to support your physical activity. To put it simply, the higher your VO2 max, the better your health will be. But there's a catch. VO2 max does not change quickly. It's a long-term metric, meaning that getting from a low levels to elite levels take consistent training over years. This makes it a reliable indicator of your cumulative efforts towards a better outcome. There's no cheating for the exam. You have to put in the work to get a better result. The graph here is from Peter Thiel's podcast, and he does a great job of demonstrating how VO2 max declines as you age for everyone. What's important to note is people who remain at higher levels and then continue to perform demanding activities. For instance, the green curve shows those of the 95th percentile can still run a 10 miles per hour, while the red curve highlights they are facing many struggling at basic tasks of walking. So that is very telling. Here's why it gets interesting. While everyone's VO2 max declines, those at higher starting levels maintain the ability to do more for longer. That is the essential why you have to build VO2 max early in life. In summary, achieving and maintaining a high VO2 max is one of the best things you can do for your longevity and health span. It doesn't mean living longer, it means living with more mobility, energy, and independence. So keep aiming for high levels of VO2 max, and you'll invest in a better quality of life for decades to come. Let's talk about the grip strength measurement, the handheld dynamometer, and why it is widely used in population studies. Grip strength serves as a powerful indicator of not just upper body strength, but overall muscle function and health. It is a simple, quick, and easy to administer, making it a practical tool for both research and clinical use. One of the reasons grip strength is so valuable is it reflects overall muscle strength. While it primarily measures your hand and forearm muscles, it gives us insight into broader muscular health. It makes us a good proxy for total muscle strength in large studies, whereas impractical to measure every individual muscle group. Another critical point is how grip strength correlates with functional ability. Think about the daily tasks we rely on, such as carrying groceries, opening jars, lifting objects. Grip strength directly relates to how well we can perform these activities, which in turn impacts our independence. It also correlates with walking speed and balance, two essential factors of mobility, especially as we age. This makes grip strength a solid predictor of falls and mobility impairments. Additionally, grip strength acts as a prognostic indicator for health. Research shows that individuals with lower grip strength have higher mortality rates, particularly from cardiovascular and respiratory diseases. It's also linked to longer hospital stays and higher rates of complications during recovery. This makes it an essential measure for assessing both current health and future health risks. Grip strength serves as an indicator for nutritional and overall health status. A decline in grip strength may reflect poor nutrition, chronic diseases, or age-related muscle loss. Diseases in arthritis, diabetes, sarcopenia often result in a diminished grip strength, providing a non-invasive way to assess these issues. Perhaps most importantly, grip strength is a strong predictor of longevity. Studies have shown that higher grip strength is associated with longer life expectancy The data is clear. Tracking grip strength over time can help you identify individual risks of rapid physical decline, giving us an opportunity for early interventions. Several large studies back this up. The SHARE study, the UK Biobank, and the PEER study all found grip strength is a good predictor of cardiovascular mortality than blood pressure, underscoring the importance of its health markers. In conclusion, the handheld dynamometer test is an invaluable tool, provides insight into muscle strength, mortality, and overall health, making it a critical measure for promoting healthy aging in individuals at risk. Alright, so this is going to break down some of the results of your hand-held dynamometer test. We are breaking up into the males and females based on the color on the top, and this is the percentiles. So if you want to be just the average individual, you're going to be in the 50 percentile if you're a male and the female. We want to be the highest percentile. So let's talk about if you're a 50-year-old man, your grip strength should be 93 to be in that 90 percentile. But as we were kind of saying, we want to try to be in 1 or 2 decades below. So we should try to aim for 111 for that 50-year-old man. So we want to try to boost our grip strength throughout this process. And another unique thing I found throughout this process is there's a lot of grip strength studies, and there's differences between them. The older ones tend to report a higher grip strength values compared to the more recent ones. And first, I think the sampling methods probably changed a little bit. Older studies used in different tools and less standardized approach, and earlier studies might reflect just healthier population, particularly in the physical activity levels, more before the computer age, people not behind the desk as much. Second, those physical activity levels. We also have increase in obesity. Obesity has a lot of different health detriments as well. Another difference that we kind of found is the age range. Is the newer studies go on to individuals in their 80s, 90s, and 100s. And this provides a more complete picture of how grip strength declines with age. Finally, in conclusion, while older studies may have shown higher grip strength values, newer studies offer more accurate and wholesome view of grip strength across the lifespan, reflecting in physical activity, lifestyle, and population health. The 4-stage balance test is a quick and effective way to measure your balance, especially as you age. Balance is a complex system involving multiple aspects of your body, involving critical aspects of maintaining independence as you get older. Our ability to balance naturally declines with age, and when balance is reduced, our risk for falls increases, potentially leading to injuries. This is why balance testing is so important. It helps us catch potential issues early and take action. The 4-stage balance is simple 4 progressive stage test. Each challenges you a little bit more. The goal is for each stage to hold each position for 10 seconds. So let's go through each stage. Feet side by side. Easiest stage, with each feet together side by side. Most people find this easy. It is good to be a good starting spot to get familiar with the test with a large base of support. Successfully holding each position, and you're going to have to cross your arms over your chest the whole time in an X pattern. This is kind of how the test is standardized. Then the next one, you're going to get into each position without using support, so your hands have to stay on your chest the whole time. So the semi-tendon stance is having your one foot slightly in front of the other. And then this stance narrows your base of support just a little bit, requiring a little more engagement or stabilization muscles. Next, we have the tandem stance, where you're going to put one foot directly in front of each other, like you're standing on a line, heel toe standing. This narrows it even more, making it harder because your base support is reduced, demanding more from your balance. The tandem stance simulates real-world situations like we might have to navigate narrow spaces while maintaining balance on uneven surfaces. Then last and the hardest stage is going to be standing on one leg. Balancing on a single leg is demanding, requires significant coordination, muscle strength, proprioception of that body's understanding where it is in space. The stance is a great indicator of overall balance and stability. If you can hold this for 10 seconds, the sign your balance system is well functioning and under difficult conditions. For each position, the goal is to hold for each 10 seconds. If you can maintain stability without stepping or losing balance, you pass the stage. If you lose balance before 10 seconds are up, this indicates that this is a hard position and you're not ready for the next stage. This is a great test because you can track this easily and you can see progress or lack thereof or regression, so you can have early intervention. And throughout this process, there's even higher level stages that we will talk about where you can actually close your eyes with standing on one leg or turning your head to challenge other aspects of your balance, something that we are not part of the standardized test, but things that as we are getting older, I want to hold each one to a higher standard. Now that we covered the foundational stages of the 4-stage balance test, let's explore 2 advanced stages, stage 5 and stage 6, which I just created. These exercises are designed to take balance training to the next level by removing visual input and challenge the body's ability to adapt to dynamic changes. Stage 5 focuses on standing on one leg with eyes closed. By closing the eyes, we're removing a major source of balance information, our vision. This forces the body to rely more heavily on the proprioceptive system, which gathers information from our joints, muscles, and ligaments, and the vestibular system, which is located in the inner ear, which detects motion and spatial orientation. As a result, this exercise strengthens the stability muscles and enhances overall balance coordination. Now, stage 6 adds on this by slowly turning the head while standing on one leg with eyes closed. This introduces a dynamic element challenging the vestibular system even more, and thus kind of hard for the vestibular system, so it's even more challenge for that proprioception system because the vestibular system is working quite hard. The head movements simulate real world scenarios like turning your head looking at someone while you're walking or reacting to the changing environments. Both stages are essential for aging gracefully because they address a common issue, the over-reliance on balance on your vision. As we age, vision can deteriorate, making it critical to train and rely on more proprioceptive and vestibular systems. By practicing these exercises, we can maintain better overall stability, reduce the risk of falls, and improve confidence in movement. For safety, I recommend practicing this near a wall, a chair, or in a corner, and kind of surrounding yourself. I call this your safety balance, a safety corner for balance. So there's a psychological component of balancing it. If you feel like you're not safe, you're gonna not get the most out of that balance routine. Especially when first starting out, I encourage people to progress gradually, focusing on form and awareness rather than duration. And if you don't feel safe, please have maybe a loved one next to you while you are doing this, so it makes you feel more comfortable and confident. We're exploring the mini best, which helps us understand measures of balance capabilities, particularly in the aging adult. Balance is essential for safe movement and independence as we age. Maintaining balance becomes increasingly challenging. The mini best test breaks down into four distinct domains, each targeting a different aspect of our ability to stay upright and move confidently. Let's start with the anticipatory postural adjustments. This part of the mini best allows us for someone who prepares for the body for expected movements. Think about a simple act of standing up from a chair. This requires a forward shift in weight, stabilization before lifting off. This test involves standing on one foot, raising on one toes, requiring controlled movement. When people struggle here, it indicates that they are less able to manage steady, voluntary shifts in balance. This could lead to trouble when reaching the needing to catch themselves from a minor trip or steady themselves on uneven ground. Next, we have reactive postural control. This evaluates how someone responds to unexpected shifts in their balance, like being nudged or slipping. This instance in the test, for instance, in the test, the therapist might slightly push or allow the patients to unstabilize, and the patient has to quickly stabilize themselves with taking a step. Good reaction control is critical for reducing falls who happen to be caught off guard. For example, if you suddenly step onto an uneven path of ground and someone bumps onto you, having a quick responsive can help you prevent falls. Sensory orientation, and this is another critical aspect. This part assesses how well the body uses information from the inner ear, eyes, and proprioception, all those aspects of balance. To imagine walking through a dark room or across a gravel path. If someone scores low in this domain, they might rely too heavily on visual cues or, or struggle in low light situations, where balance relies more on the inner ear and body awareness. Finally, dynamic gait looks at the balance while walking, performing complex movements. This could involve walking at different speeds, turning quickly, or stepping over obstacles. Dynamic balance is what helps us safely navigate through the real world, especially in environments that change quickly, like walking through a busy grocery store or moving through uneven ground outdoors. Each of these domains is scored to identify specific strengths and weaknesses. If someone has difficulty in reactive controls, for instance, we can work on exercises to improve their response to unexpected cues in balance. This test enables us to design targeted interventions to strengthen the weakened areas, ultimately helping our clients move more confidently and reducing the risk of falls. Each category is scored, and the totaling it up it equals up to 28. If you score less than 28, it does put you at a high risk for falls, and you will benefit from therapy. So, in summary, Mini Best gives us a structured approach to balance assessments by breaking down into specific manageable areas. With this tool, we can tailor our approach to each individual needs, whether they need work on anticipatory movement, reacting to the unexpected, improving balance while on the go. This is a powerful step towards aging gracefully and maintaining independence for as long as possible. Let's dive into diaphragmatic breathing, which is the starting point of our journey of aging gracefully's stability aspect. Often called belly breathing, it often relies on the diaphragm, the muscle that sits just below the lungs. So take a deep, controlled breath. Why start here? Because diaphragmatic breathing is a fundamental to core stability and easy to learn. It is simple as focusing on your breath and gradually controlling the depth and the pace. Now, as we breathe, it is directly connected to our ability to move safely and steadily, which is critical as we age. By breathing deeply and engaging the diaphragm, we stabilize our core without even thinking about it. This stability acts like a strong base, keeping us balanced and reduce injury risk. One key advantage is that diaphragmatic breathing also makes us more aware of our bodies, helping with posture and tension. It reduces the tendency to rely on our neck and shoulder muscles, which often leads to postural tension. It reduces the tendency to rely on our neck and shoulder muscles, which often leads to unnecessary tension. So why just a few minutes? So with just a few minutes of this type of breathing each day, we can actually keep our upper body more relaxed. Another significant benefit is our lung health. Our lung capacity can decrease as we age, but when we engage in belly breathing, we expand our lung volume, ensuring good oxygen flow to our muscles. This is critical for maintaining the endurance we need to stay active over time. Finally, diaphragmatic breathing is for everyone. It is low intensity exercise, easy to start and incorporate into daily life, even just in bed or while sitting. It is not just an assessment tool, it is a skill we can use to empower our activity from basic strength exercises to cardio. And it's a great tool to actually help reduce that stress response. We have two states of being: the sympathetic, you see a bear, you're going to run away or fight the bear, or that parasympathetic state, more that relaxed. So it's a great way to get from that stress state to that relaxed state. And I have people incorporate this when they're in bed trying to sleep. To start off with like a minute or two of breaths, and helps you focus on your breath instead of ruminating on the day, so you get more effective sleep. Now switching back, we also have a little kind of grading system that I kind of created to help track progress. It's based on the length of each breath and making sure we are able to engage and expand the whole waistband, not just the front, but making sure we engage everything. It's just a good, simple way to measure to see improvements over time. This approach makes breathing more intentional, promotes stability, and lays foundation for continued growth on the aging journey. Alright, so now we're going to be diving into the specific scoring system we'll use to help us objectify measures and how while you're breathing and making sure we're not relying on that chest so much. So let's go through some of those scoring stages. The first setup, you make sure you have to begin laying on your back in a neutral spine position, hands on the chest, hand on the belly. This ensures the ability to give them feedback on parts of the torso that are moving. The chest is rising more than the belly. It suggests that you're not using the diaphragm effectively. Neutral spine is critical here. It helps us keep the core muscles in the optimal position to help support breathing. Next, controlled breathing. Next, we assess basic breathing control. We're looking for a smooth 2-second inhale, slight pause, then a 4-second exhale, and a pause for about 2 seconds. And during this stage, there should be no chest movement. Only the chest should be expanding. Only the belly should be expanding in the inhale. This shows they're using their diaphragmatic rather than the chest muscles to breathe. And there's going to be some movement of the chest. It's more of a bucket handle move versus it going towards the head. Just want to make sure you're kind of clear that it just can move, just how it moves. Progression 1, side expansion. As participants get better, will progress to focusing on expanding laterally or going out to the side and back down the back into the lower back. Now this is where you place your hands on the sides of your waist and feel it expand all the way around, not just the front of the belly, but also the side and the back. This 360-degree expansion is a sign for optimal diaphragmatic function. Then the next progression after you master that one is improving the breath cycle to 5 seconds inhale, 10-second exhale, then a 5-second pause without any breath. And each level has a specific point system associated with it. It's a great tool for both strength and the endurance of the diaphragm. And then finally, we have the breath hold test. Finally, we assess the ability to hold the breath while fully exhaled. If they can hold it for over 20 seconds without twitching, having any constant movements, this shows a strong diaphragmatic control and effective breathing muscles and ability to get from that stress state, that sympathetic state, to more of that relaxed state, that parasympathetic state. Unfortunately, a lot of people, we live in that stress state, so this is a good, very cheap, easy way to get to that relaxed state more often and see if you're there or not. This test reveals how our breathing capacity and endurance, which we all need work on improving. This structured scoring approach helps us understand and improve diaphragmatic breathing, a core element of stability. With regular practice, participants will develop a better breath control, which supports core strength and stability in other movements. Moving on, about the 3 mobility tests are essential for evaluating individual risks for fall and overall functional health, especially in the older adult. So let's start with the seated toe touch. The seated toe touch is primarily assessing the flexibility of hamstrings, lower back, and hips. It's simple yet effective way of measuring overall lower body flexibility. To perform this test, have a subject sit against the wall, legs extended straight forward. They should keep their back straight and knees flat against the floor. Then slowly reach forward with both hands attempting to touch the toes and hold the position for 2 to 3 seconds. We'll measure the distance between the fingertips and the toes. Excellent flexibility is an indicator if they can reach beyond their toes. Good flexibility means that they can touch their toes. Average flexibility is reaching 0 to 3 inches from the toes, and poor is farther than 3 inches away. This test is significant because it directly measures the flexibility of key muscle groups involved in bending and reaching. Good flexibility in these areas is critical for activities like putting on shoes, picking up objects from the floor, maintaining proper posture. Limited flexibility can contribute to poor balance and increase health risks, especially when bending and reaching. Moreover, tight hamstrings and poor lower back flexibility are often associated with lower back pain and increased risk of injury. To improve performance on this test, it is recommended regular stretching routines focus on hamstring, lower back, yoga and Pilates classes, and progressive flexibility training to guidance of a physical therapy or personal trainer if needed. Moving on to the second test, the knee to wall test, which assess ankle mobility. This test evaluates ankle dorsiflexion as a big fancy term, bringing your toes to your nose. And to perform this test, have the subject stand facing the wall with their toes touching it. They should keep their heels flat on the ground, bending their knees towards the wall, trying to touch it without lifting their heels. If successfully, they move their foot backwards incrementally and repeat until they can no longer touch the knee to the wall without lifting off the heel. Then measure the distance between the big toe and the wall. Excellent mobility is indicated by a score greater than 5 inches. Good mobility is 4 to 5. Fair is 3 to 4 inches. And poor is anything less than 3 inches away from the wall. The significance of this test lies in the indirect assessment of the ankle function and its impact on gait and balance. Proper ankle mobility is essential for a normal gait and maintaining balance during walking and standing. Reduced ankle mobility can lead to compensation movements, potentially injuring knees, hips, and lower back. To improve ankle mobility, we recommend calf stretching exercises, ankle mobility drills, myofascial release techniques, and strengthening exercises of the ankle dorsiflexors, pointing your toes away. On the final note is the anterior lean, also known as the fall envelope test. This tests the individual's ability to control their center of mass forward during leaning. It evaluates balance, toe strength, and overall stability, which are critical for fall risk assessment. To perform this test, have the subject stand upright with feet shoulder width apart. They should keep their body straight and rigid and lean their body as far forward as possible without taking a step. They should hold this position for 2 to 3 seconds. We measure the distance from the starting point of their belly button to the maximum lean position. Good stability is anything higher than 7 inches of movement. Fair stability is 4.5 to 7, and poor is less than 4.5 inches. This test is significant as it directly measures the ability to control one's center of mass during the forward movement. It reflects the strength of intrinsic foot strength, particularly in the toe flexors, which are critical for balance. A smaller anterior lean distance is associated with increased risk for falls, especially in the older adults. It is also indicated for safe limits for forward reaching in daily activities. To improve this, we recommend toe strengthening exercises, balance training, core strengthening, Tai Chi, and other practical measurements such as yoga and Pilates that emphasize weight shifting and balance and working on proprioception. The anterior lean test provides a valuable insight in an individual's falls risk and overall balance capabilities. They are commonly used in physical therapy assessments, sports medicines, and assessing fall risk. By identifying limitations in flexibility, mobility, and balance, we can help you develop a good program and personalize it. These last few slides are something that we cannot measure, and it does require specific equipment to do, but I think it's very valuable that I discuss it, even though I can't measure it. It's going to be talking about the DEXA scan. This is a tool that is becoming increasingly important in health and longevity discussions. It's something that Peter Attia dives into a lot in episode 227 in his Drive podcast. You may have heard that it's a scan that provides a clear picture of your body's makeup, your fat, your muscle, your bone content, about what makes it so special. This is why it is so valuable in understanding your health. First off, it's safe, quick, and effective. It uses a low energy radiation and takes less than 20 minutes. And here are just a kick. It provides much more detail than information just stepping on a scale and measuring your body mass index or your BMI. A DEXA scan shows your body fat percentage, which gives you a better idea of what your weight is really made out of. For example, it measures your visceral adipose tissue, your VAT, the fat around your organs. Too much of this fat can increase your risk of serious health problems like diabetes and heart disease. It also looks at your bone mineral density, BMD, which is a key for tracking bone health, especially preventing or managing osteoporosis. Lastly, it measures muscle mass using a few different other indexes of 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 your limbs, but also your total mass, which can help you understand your overall strength, metabolic health, and functional fitness. Now, how can we make the most of the results? Getting a DEXA scan once a year is more than plenty to help track progress and help us address concerns as they arise. For example, if you show you have low muscle mass, that's a signal that we need to incorporate more strength building exercises. Or if your VAT is too high, your visceral fat is too high, it may be time to fine tune your diet and focus more on specific cardio exercises to address that need. All this data gives us the ability to be proactive in maintaining and improving your health. By working together, we can take your information from your DEXA scan, create a plan that suits your personal goals, whether it's losing fat, building muscle, or building bone strength. And I always like the ideal test, don't guess. One of the biggest myths in fitness and health is assuming that we can look at someone and predict their health, particularly when it comes to fat distribution. Someone might look and appear fit on the outside, but still have high visceral fat. Visceral fat is particularly dangerous because it wraps around internal organs and is linked to all kinds of chronic diseases. But the tricky part is you can't tell someone's fat just by looking at them. And this brings me to the bathtub analogy that Peter Thiel uses in his book, and the podcast, The Drive. Imagine that someone's fat storage abilities is a bathtub. Some people have really large bathtubs and can store a large amount of fats in healthy spots, which means your subcutaneous fat. That's the kind of fat underneath your skin. Others have smaller bathtubs and fill up faster. Now, when your bathtub fills up, that excess fat overflows, and that overflow becomes your visceral fat, which starts accumulating around your organs. So when someone has a smaller bathtub, might have the same body fat percentage as someone with a larger one, but their VAT levels are higher because they're overflowing into dangerous areas more quickly. And just a little bit of overflow is very stressing. Just like if you have a bathtub, 1 or 2 gallons of water outside your bathtub could get in your vent, get into your electrical system, and cause havoc. Same thing if it goes into your visceral fat. That's why the tools like DEXA scans are so important. They can help us test rather than guess what's really happening inside your body. By getting a detailed breakdown of what fat distribution is, muscle mass, bone density, we can take early action and prevent these health risks. It's like taking control of your own health instead of letting things happen by chance. So remember, just by looking in the mirror or stepping on the scale won't give you the full picture. Getting an in-depth analyze from a DEXA scan will allow you to catch problems early, guide your health goals, and keep that bathtub from overflowing into dangerous areas. And just remember, for more and more in-depth conversation, go to episode 227 on Peter Tia's podcast. This line goes into more detail about exactly what measurements should be captured onto the test. So if you ever questioning what information is needed, I always contact a business and saying, do you have results in these different categories? And for this, it's going to be important to say, like, what are the standardized approaches to take the test? So more like the logistical things, trying to make sure that you have a consistency over time, and that's going to be one of the goals of this. And once you get the numbers, all the numbers actually representing what they say they are. And then when you get the numbers, hopefully they're going to give you information about where you fall and stack up to others. If not, Peter T has provided kind of copies of kind of normative data for it. So that's going to be included into the notes. That I do encourage you to be part of his membership program so you can access these notes as well. Because I'm guessing these are probably not going to be very formatted very correctly, and you probably can't see them very well. If you do want and looking into doing this just have to be completed by your own. We do not provide services like this. I am working with some individuals and businesses that do offer this. Just let me know, and I can try to get you hooked up with a discounted rate to get these scans completed. So this body composition testing with the DEXA is going to be, unfortunately, I can't provide that service for you, but so you're going to have to complete it on your own expense. We have partnered with DEXA Fit Medicine. So Jessica and Adam are the owners of DEXA Fit in Madison, and they agreed to give my Aging Gracefully patients and clients a discount. So as we talked about, there's some packages that we negotiated. If you want to have the DEXA scan, which we just discussed why it's important, and then we talked about VO2 max estimate. Now you're actually going to have a legit test of it, and then they have the 3D scan of your body as well. So that's going to be a $200 value, and feel free bring your spouse along as well. They get the same discount. Then if you want to have the additional test, the RMR, so it's going to be measuring what energy sources you use, fats or carbohydrates, and that's going to add some additional benefits of it, and we'll probably end up talking about that later in future weeks with the energy sources and why it's important to burn more fats than carbohydrates. And that's going to be a package at $315, which is going to be down from a regular $500. So this is going to be a one-time fee for new clients for them, but they are offering us a 10% discount on people who are following up with them. So I just want to give you that opportunity that we have a connection with this, so you don't have to end up spending the whole dollar amount with this. So hopefully you can take in consideration. I do understand that is a quite lofty fee, but based on all the places where you do get this testing, it's going to be much more expensive. So they are very reasonable, and you get a lot of data for what you get. So that wraps up all the baseline measurements that we will be collecting. I do have a sheet of paper that you can write all your scores down. You can take that home and you complete it as you need and you want. Next week's session, we will be trying to go through and measure a lot of these things with you. I'll make sure you are cleared and you're good to go with your exercise. I don't have any injuries or risk with this. If you feel like you will qualify or you need to have a one-on-one session because you have an injury or you have any kind of difficulties doing activities that you normally like to do throughout your day-to-day tasks, that does qualify you for physical therapy, there'll be a sign-up sheet in the back, as well as you can scan this QR code, and that will bring you to a spot where you can start the process of having physical therapy. It has been a pleasure during the second session with you. I'm looking forward to hopefully many more sessions with you guys.